welcome back. We have Marvin on the phone again, who basically, hopefully we fixed the issues. Marvin, are you there?
Yes, I am, and I muted my TV so it's not confusing to listen to. Try and listen to both. Can you hear me all right?
I can. What's your question?
Well, it's about that ultrasound. 5 weeks I've been waiting for it, and Renee has fixed me up with Desert View. But it's going to cost me $50 to go over there, where if I go all the way into Las Vegas to VA hospital, they'll do it for nothing. But I don't want to make that long trip and go through what I had to go through last year.
Okay.
The woman that did the ultrasound went over my aorta, and it very tender there, and she's pressing too hard. I told her stop pressing so hard, but she said she had to do it. I heard that in your office, the ladies there said the person that does the ultrasound is very good and probably would not hurt me. Desert View had done it once, and they didn't hurt me. They were very good at it. So I was just wondering why you don't get that ultrasound fixed. You don't make enough money?
No. I think it's because we had a hard drive failure, and Arthur, our ultrasound technician, was trying to get a company to come in and reboot and reload that hard drive. But he runs Pahrump Medical Supply, and he also had a brand new baby. Well, he didn't have it, but his wife did, and that was a couple, 3 weeks ago. So I think his life's been upside down too. And I'm glad that we have another option for you, which is the hospital, but I don't think waiting 2 or 3 weeks is going to make a big deal. And I was trying to pick up the ball today to try and figure out where that went. So if you will call and talk to Renee Ratliff tomorrow. She's got a special number, and we'll see what we can do about trying to get this expedited for you down to a place where you can get it done safely and efficiently without any pain for you.
Well, I'm trying to get VA to, but see, my provider at the VA clinic here retired last week, and they're having to go through someone else who's just a nurse, from my understanding, Carl. He isn't a PA, he isn't a doctor, so I just have to sit back and wait. I don't find it emergency. I've been going a little over a year now without that ultrasound.
No, and it probably not if we're just checking on an aorta, whether or not it's grown or not. It's not an absolute emergency. I wouldn't think you would, unless you were having pain or some other issue, that it would be, and then a CAT scan would be more appropriate for an aortic aneurysm if you were worried about whether you were having pain or leakage. But a lot of times we'll follow an ultrasound for aortic aneurysm size, and not having your chart in front of me, I'm assuming that that's what we're talking about. That being said, it's not critical in the absolute time. You don't want to let it go too long, and then the aorta get larger than 5 centimeters or 6 or 7, and it rupture, and that's a fatal event.
Nancy Donahoe did the surgery, and from what I understand it, she did a very good job, what the VA vascular surgeon had told me.
Well, listen, Marvin, nothing to say anything bad, but I don't like to practice medicine on TV per se, but if you want to come into the office tomorrow, I'll certainly make time to deal with this issue with you. How about that?
Yeah, I don't want to take up your time on the phone.
No, I mean, I don't want you not to have your issue taken care of, but this is something that, is one of those things that happens when you have equipment. It does break down, and I don't want to solve this issue on the phone, and I do recognize the importance of what you have to have done, and at the same time, it's not an issue I can solve right here and now. I can't call somebody and find out where it's happening. I can't get you an answer because I'm tied to a mic, but I do recognize that it needs to be taken care of, and if you want to come in and see me tomorrow, we will take care of it.
Yeah, okay, I appreciate your time, but I don't want it to ever rupture again either. That's the most horrendous pain I've ever had.
Yeah, no, I empathize with what happened to you. My only solution is to get you into the office so that I can get you face to face and discuss it and we can figure it out.
All right. See if we can set up I'll call in tomorrow and see if they can set me up an appointment with you. I talked to the other doctor, and he sent me over for an X-ray, and I had done that, and it was about another problem I had.
Yeah, well, just ask Cheryl. Just tell Cheryl I told you to come in tomorrow.
Yeah, I'll talk to Cheryl and see if she can set me up an appointment with you, and I only take about 5 minutes, or at least I'll try and take 5 minutes of your time.
No problem.
All right. Thanks a lot. I appreciate it, and I do like your office.
Thank you. Thank you for calling in tonight, too.
You're welcome.
Bye-bye. And certainly, we want to take care of all those problems, and this is probably one of those opportunities that if you're a viewer, you can get me on the phone. It's sad that you have to do it like that, but it is busy, and we do try and take care of everybody we can. But that being said, it is one venue and one opportunity to have those problems solved. Okay, so getting back to Ray and the methadone. Methadone is a very interesting opioid. It was actually developed in the 1930s through, or I think 30s or 40s through Hitler, who told his scientists to develop a opioid that was an alternative to morphine, and they came up with methadone, which also is termed dolafine, and it is a very long-acting opioid, and probably about 12, at least long half-life, maybe close to at least 12, sometimes probably up to 18, depending on your metabolism. That being said, it is actually, if everybody's watched the movie Terminator, there's a scene in one of the movies where his power pack basically goes bad, and you see him rerouting the power of his through a different channel to go to where he needs to go. Well, pain in a lot of ways is like that, meaning it has a spinal cord as its electrical ascending pattern, meaning it goes up through your spinal cord where it reaches your brain and your cortex, and it's where you develop the reaction to pain. You'll feel something, and then the reaction will be ow or scream or something along that line, which obviously is something that you've learned how to do, because if you've ever watched a young baby who has fallen, they get up and they hurt themselves, but there's no reaction, there's no nothing, and all of a sudden somebody goes, oh, like that, and then they start crying. So they learn these responses to pain, and these are some things that are kind of reflexive. That being said, you can block one particular type of pain with morphine. Morphine works in one particular area of the body. You know the pain's there, you just don't care about it. Some of the latest and other medications like Lyrica or gabapentin block other ascending pain fibers. And they block them in different areas. But methadone is one of those drugs that actually acts like an umbrella. It actually blocks all ascending pain fibers. So it's a very, very good pain reliever. In fact, it is probably very effective in what we call neuropathic pain, which is nerve pain, and it has a special affinity for those particular types of pain. Unfortunately, methadone is one of those drugs that if you talk to patients about using it, oh, that's what they give heroin addicts, and so it's kind of like the Anthony Perkins routine. It didn't matter what role Anthony Perkins had after he played Norman at the Bates Motel. That was his calling card. That's what he basically was. He was always Norman, and probably a very good actor, but after that role, that was in Psycho, that's all he was. Well, that's true with methadone, meaning if you bring up the word methadone, you're giving it, that's what they give to heroin addicts. Well, yes, they do. But within heroin addicts, it's basically one of those things that you're coating the opioid receptor, and you're actually providing some type of pain. There's a thing within chronic opioid use called hyperalgesia, and what that means is your body develops an inordinate amount of pain, and this is the downside of the opioid highway. There is no ceiling, there is no amount of opioid that I cannot give you. I can give you whatever you can take without obviously dying, but and you develop a tolerance to every opioid. But that being said, when your body gets exposed to them, they coat the mu receptor, the opioid receptor, and then the pain goes away. Well, your body builds more receptors, and so when it wears out of your system, the opioid receptors are now waking up and they're screaming for more opioids. So herein lies the basically incentive to take more medication. Ooh, I'm hurting again, I'll take more medication. And there is a euphoria associated with opioids, this I don't care or energy, or people get different reactions to medications. That being said, the hyperalgesia side of it is what gives you the incentive to take more. So by relieving that and coating the receptors and obviously keeping it around in your system, you help to avert the physical withdrawal of opioids. And that's where methadone is probably very, very effective in reducing the physical hyperalgesia associated with pain, because not only did you have the pain that you were treating with the opioid, but now that it's been withdrawn, you've got the hyperalgesia that's associated with it, which is skin itching and skin burning and things of that nature that you didn't have before. So that's why methadone is very, very effective, and heroin being one of those particular drugs, which is obviously very euphoria producing. It also helps to block the high that people will get from using methadone, heroin, so that if they basically are taking methadone and then they want to use heroin, they don't get that quite euphoric rush. So it does have some benefits in preventing the opioid craving and reducing the amount of that. Being said, is there always a risk of people injecting too much and dying from heroin, and that is true. And once they started cracking down on the problem with oxycodone in the community, heroin made a resurgence. So I guess the moral of that story is people will try and get high no matter what the answer is, and so drug abuse is prevalent in the community. And we're going to go to break, and I'm going to talk a little bit more about methadone and some of its nice pain relieving and some of its bad effects when we come back. Thank you for tuning in.